Hello, my name is Katie Schubert. I am president and CEO of the Society for Women's Health Research, which is a national nonprofit based here in Washington, D.C., dedicated to advancing women's health through science, policy, and education. And our mission is to make women's health mainstream. For more than 35 years, we've worked tirelessly to advance that mission through what I would call our relentless advocacy work. It's through this experience that we've witnessed firsthand how advocacy in women's health has evolved over time through so many iterations. Members of Congress come and go over the course of 2 or 6 years, depending on which side of the Capitol you're on, and administrations change. And here at SWHR, we've been through 5 administration transitions. But despite those changes, the core competencies of what it means to be a women's advocate continue to hold true over time. We do know, however, that there's been a lot of momentum in recent years in this space, and there's a new generation of advocates who are reshaping the landscape of healthcare to be more responsive to the realities of women's lives on everything from menopause to chronic conditions and beyond and between those things. We're seeing a growing number of people, everyone from patients to providers to researchers to caregivers, to people who are just passionate about the cause and expressing a desire to get more deeply involved in championing women's health. And we love to see that. We want you to join us, join our army that we're creating as we work to advocate for women's health research. And your voices are so needed in this work. We know that starting in advocacy can be intimidating, and that's why we created a guide from awareness to action, a guide to women's health advocacy. And it's evergreen. It's a toolkit that was designed with you as advocates in mind. Even if you don't think of yourself today as an advocate, we know that you are, and we're here to help give you the tools that you might need or to make you feel a little bit more comfortable in that endeavor. And in this guide, we break down and demystify the basics of advocacy and how to effectively engage with your elected officials. It includes easy to use planning templates and sample emails to help you create and carry out your own advocacy strategy tailored for your issue area and your district. And whether you're brand new to advocacy or looking to expand your efforts, there's something for everyone in this toolkit. So we'll be sure to share the QR code at the end of this. I hope that you'll take advantage of it. But it's not just me who's here to talk about advocacy. Today, I am joined by 3 seasoned advocates who are dedicated to advancing women's health. First, we have Lauren Rotolo, who happens to be a new board member to the Society for Women's Health Research. We are so lucky to have her. She's an author, public speaker, video producer, and content marketing leader. She's nationally recognized as a disability and women's health advocate, and through her work, she uses storytelling to humanize health, science, and lived experience. She was born with McCune-Albright syndrome, which is a rare genetic disease affecting the skeletal and endocrine system. And I'll let her share her story, but she is the youngest woman on record in the US to experience precocious puberty at just 8 months old. By the age of 5, she walked full-time with forearm crutches, and rather than allowing her diagnosis to limit her, she transformed her lived experience into purpose, advocacy, and a professional success and impact. She's the author of Unstoppable and Stilettos, has received multiple awards for her work in marketing, storytelling, and female empowerment, has advised and inspired Fortune 500 companies to more authentically integrate disability into their DE&I strategies, talent initiatives, and brand narratives. And I think she's going to have a lot to share with us about her journey, but also how she has turned her lived experience into effective advocacy. Next up, we have another friend of SWHR and mine, Erica Seward, who's the Chief Advocacy Officer of Us Against Alzheimer's. She's responsible for leading the organization's advocacy and policy, coalitions, and communications work. She has extensive experience in patient advocacy, having served as the American Lung Association's lead lobbyist for 19 years with Congress and the executive branch on issues like access to care, tobacco control, appropriations, and lung disease and lung health issues. This year, she's leading Us Against Alzheimer's Women's Brain Health Initiative and is also a founding member and original board member of the Partnership to Protect Coverage and serves as past president of the board of directors of the Coalition for Health Funding. And finally, I'm happy to introduce Sateria Venable, who is a patient advocate and researcher for uterine fibroids since 2007. Another great example of turning your lived experience into power and empowerment in the women's health space. She's the founder and CEO of the Fibroid Foundation and has advocated for more than 26 million women in the US with uterine fibroids and for those diagnosed with fibroids globally. The Fibroid Foundation reaches over 180 countries, providing support and education to erase menstrual stigmas. She has done so many things in the women's health space related to fibroids and beyond, going into the healthy aging space and menopause, and has been the recipient and working with directly the National Institutes of Health on research related to uterine fibroids, which is really exciting. And again, part of this is to hopefully provide some hope and optimism as we think about how we can really turn this advocacy into action. I want to thank each and every one of you for joining the conversation. I'm really excited to hear your expert insights on how those who are watching can use this toolkit and become an impactful women's health advocate. So before we get to our wonderful speakers, I want to lay the groundwork for why women's health advocacy matters. And I've seen the power of advocacy in driving the field forward. I am a former congressional staffer. I am a former lobbyist, a registered lobbyist, worked at a lobbying firm, was a chief advocacy officer for maternal fetal medicine before coming over to the society. And so understand that it truly makes the voice of those who are impacted by policy matter to make that change. I do want to lay the groundwork a little bit in terms of why this is a problem. A lot of times people don't necessarily think too much about this, but it wasn't until 1993, which was not that long ago, that the NIH Revitalization Act finally required that women be included in federal clinical trial research. Before that, women were intentionally and actively excluded from research due to concerns surrounding their reproductive health. And the thinking was legitimately that women were just little men. And so you could just extrapolate out the data in the male population and understand what that would mean for women and women's health. We obviously know that that is not true, but that is the reason why the Society for Women's Health Research was created, to work against that thinking, to work to advocate for the NIH Revitalization Act and ensure that researchers were able to look at things like sex differences. It turns out there are differences between men and women, and we want to make sure that we're understanding those details so that we can receive personalized medicine. So the change required and the advocacy required to make that actual change wouldn't have been possible without the collective efforts of advocates who were raising the alarm on the short-sightedness of how we understood the research. And so thanks to the NIH Revitalization Act, we now do have a better understanding of women's health and sex differences, but we do have a very long way to go. So that change, which was related to sex differences, so sex as a biological variable is what we call it, or SABV, wasn't actually something that was required for researchers to just consider until 2016. So we're coming up on, here actually in a few weeks, January 25th, the 10-year anniversary of the implementation of that policy. That one was not a law. It was an internal policy at the NIH, and we continue to look to make sure that that's being implemented properly. But it's really aimed at making sure that researchers have the tools that they need to fully understand how to consider sex differences, why they should consider sex differences, and then as we think about translating that research into policy and care, whether it matters for men versus women. So really important things here as we're thinking about it. So you can have advocacy thinking about the congressional branch, as I mentioned, the legislative change. You can think about the executive branch and the regulatory agencies like the NIH with the Food and Drug Administration. We've seen that happen as well. And all of that can influence how legislation is introduced, amended, passed, and then the implementation side of it, which is really up to the administration. There's also the judicial branch, obviously, when we're thinking about the three legs of the stool in our federal government. And legal advocacy can impact landmark court decisions and interpretations of constitutional rights. So there are lots of ways to think about advocacy on the policy side, but there's also ways to think about advocacy from a personal standpoint as well, which we will get into. All of this is to say that advocacy, in short, is a way to drive positive change and hold our institutions accountable, and will ultimately make our lives better and healthier. When we think of advocacy, we usually think of it in terms of the policy angle, in terms of with Congress. But obviously, as we just talked about, it can take many forms and has value across spaces. So I am going to leave that there and we'll get it more into the toolkit, obviously, sharing the link. I'm going to ask Lauren to hop on screen and ask her this very important question, which you are a seasoned women's health advocate in your personal life, and you've been going to the Hill as well. But I want you to talk a little bit about how you define advocacy.
Hi, everybody. Thank you, Katie, for letting me be here today. I think that advocacy can be defined in many different ways. Everybody may have their own definition. And as you said, you know, many people believe that advocacy is just speaking to Congress. But I believe that advocacy starts with self advocacy, understanding your own value, educating yourself in when you're speaking about healthcare specifically, is educating yourself within your own health or the health of others that you are trying to advocate for, and being willingly to question your care so you can take an active role in your own health. I think that that is so important. And then from there, it's about taking that lived experience to shape the system's influence policy and use your voice to tell your story so that others don't have to navigate their health alone and they can come to you for advice. If you can tell your story, and you could help others want to tell their story, and you could help others become educated. And I think that that's a role that others don't really speak about when we talk about advocacy, is really understanding your value and really talking to your doctors and taking an avid role in your own health, and then taking that, creating your story so that you can help others.
That's amazing. Thank you for that. We so appreciate it. And I think you're totally right when you think about that lived experience and framing it from a perspective of everything that you're doing, especially when it comes to your health and well-being, is
Yeah.
advocacy, right? I
Mm.
mean, and I think once we all understand that, I think we can all feel much more empowered in our care and our well-being moving
Yeah.
forward. So
You know,
thank you so much for
I,
that.
oh, you're very welcome. And just one thing, I live with a rare disease, as you discussed before. And so I almost had to get my MD in my own disease. And I think that when you live with a rare disease, or if you live with a disease that many healthcare professionals are unaware of, or even something like fibroids that can take many doctor's appointments to even diagnose, you need to almost be ahead of the doctor to, in some level, diagnose yourself, or to really have them understand what you're going through as you get that appointment, as you're going through and ask them the hard questions.
I think that's excellent advice for everyone to take away here. Thank you so much.
You're
I
welcome.
want I want to turn to Sateria for a second. So we talked, right, when I introduced you, I talked about your lived experience a little bit and how that has driven you to found the Fibroid Foundation with the mission of advocating for the over 26 million women who have fibroids in the US. But in your work, because you engage in the advocacy side, you engage as a patient advocate, but also from the research perspective. And I think your work can sort of be described as marrying those two parts, the scientific evidence and what do we know about what that means for lived experience and patient value. And so I think that's a really important piece of it. And I want you to share a little bit with us about how you think of advocacy as a tool for shaping policy, and if you don't mind sharing a story about how you've seen that play out in your work.
Well, thank you, Katie and SWHR. I love advocating with you, and I find your organization to be just such a powerful force. So, thank you for having me today. I'll start with the story first, if I may. When I started advocating, it was even before the Fibroid Foundation was a formal entity. I was invited to participate in a research study, a national research study. I arrived at the meeting, there were 16 physicians and me, and I just like was so nervous. And then I thought, you know, I'm here to advocate for women all over the country. So I have to find my voice and try to provide any input that I feel might be helpful to advance this meeting. And as it turned out, over the course of the 5-year research study, which was in 9 clinical sites across the country, we made many recommendations to help change, like for instance the vial size for blood draws, because a lot of women who are anemic go to their doctor's office, and if they have multiple vials drawn, they feel worse when they leave the appointment than when they arrived. And from the physician's standpoint, that was something they'd never thought of. And so we reduced the blood draw for that study for all 5 years to the smallest possible vial size. And that experience started to open up, just to reveal to me personally what value there is in the patient voice, as Lauren referenced. And so then when we came to Capitol Hill, which was quite a few years later, um, I had that experience to refer to be able to more confidently go to congressional offices and understand that I was bringing a unique vantage point. I also learned as an advocate during that experience that you can find common ground with legislators, with researchers. Many of the offices we visited, many of the staffers were familiar or had family members who had suffered with fibroids. And so there was really a communal just conversation that was really heartfelt, with everyone just being interested in either themselves feeling better or their family members feeling better. And it really just propelled the mission forward. And I might add too, the male lobbyists who were with us to schedule those meetings. We had about 60 meetings to introduce the fibroid bill. They were so touched after they listened to several sessions that they shared that they had a better understanding and a more deep, heartfelt understanding, for this effort that was personal as well as professional to them. So I'd say that, in advocacy, and tools for shaping policy, developing relationships is key. Um, Grassroots momentum is really critical in advancing any initiative, and it helps to bring the issues to the forefront if it's outside of just the policy, powers that be, if you will, spectrum, if it's also, information is being shared by the patients as well.
Thank you so much for that. There were a few things there that I just want to make sure that I reiterate because I think it's so important as you're thinking about this issue. So, number one, this issue of how you bring the patient voice into the research and study design is so critical. We often say that researchers are looking for certain things and they have, hypotheses they're trying to prove through their research, but they're not thinking about what might be, not always, I think they're doing a better job now, but they're not always thinking about how to make it either easier or what the issues or challenges that a patient might face in achieving those goals. And so to your point about, the amount of blood collected or any other challenge that might come up, they're probably not thinking about that when they're creating their design because they're thinking about what is the easiest way for them to get their data. And that is not always the same thing as what is the best way to ensure that a patient wants to participate in research. So I think that piece is so important. Your point about engaging men and helping them to understand these issues is also so critical. If I know we are all a panel of women here, so, so important. And members of Congress are not only women. We have to make sure that we are ensuring that those stories that we're telling and the connections that we're making are being heard in a meaningful way. And chances are, with a lot of these issues that we advocate on, they have a personal connection to it, whether that's their spouse, their child, their mother. We hear this quite often. And so it's one of those things that the more you talk about and educate policymakers on, the better, because they will have heard of it. Or if they haven't heard of it, you have a great opportunity to really share more information with them and how it affects their constituency. And then the last thing I would share is just that when I was on the other side of the table as a congressional staffer, and I was very young when I was doing that. I did not know anything. My background is not in science. I was a political science major, which is not what we're talking about here. But I remembered every story from constituents when they would come in and meet with me. And it was really meaningful that they took the time to do that and that I could then go to my boss and say, okay, we met with this person. Here's where they live. Here's what their concern was. And here's what they would like you to do about it. And that makes a huge difference just in terms of connecting it back to their district. So super, super helpful. Thank you so much, Sateria, for that. And we're gonna come back to you. I want to talk a little bit about how we can get started. So this can definitely be an issue for people who may not feel as comfortable, or maybe they haven't shared their story a lot of times, and this is the first time they're doing that. So to start off, it's helpful to have a solid plan, a very clear goal, and a strategy of how you want to get there. And our advocacy guide does include a planning tool for you to do that. It's designed to help advocates clarify their vision, to map out a smart and strategic path forward. And it walks you through some questions to help you establish those goals and identify who your audience might be and assess the resources that you might already have or that you might need to make an impact. It also includes advice on how you can reach out to your member of Congress to schedule a meeting. I will share, and this was just my best practice, but I think it translates. If you live in the district of your member of Congress, regardless of whether you voted for them, don't share with them whether you voted for them or not, but they do work for you regardless of that. You can just pick up the phone and ask, who's the person who handles health or women's health? And you can send them an email or try to chat with them on the phone. I would always meet with anyone who was a constituent when they requested a meeting. It was really important to make sure we're hearing the voice of the constituent. So definitely worth giving that a try, but use our tool to plan it out and feel more comfortable in how you're going to approach it. So Erica, I want to bring you in here. As we mentioned, you're the Chief Advocacy Officer with Us Against Alzheimer's, and you're leading a national strategy on advocacy, and you deal with a lot of partnerships and coalitions. We know that 2/3 of people with Alzheimer's disease are women, and women account for a similar proportion of the unpaid Alzheimer's caregiving burden. And so making this area mainstream, if you will, and raising awareness and advocating for this population is incredibly necessary when we think about it in the broader context of women's health and advocacy more broadly. So if you're thinking about someone who's just starting this out, I know feels like we've all been around for a million years, although every day is a new surprise for us, it feels like. What do you think someone who's in the very early stages of their advocacy journey should be thinking about? And that could be big or small.
Absolutely. And I think the first question is, what is it that you are trying to change? Are you trying to change something in your community for which a mayor or a county council or town commissioners are the decision makers, or are you trying to do something that is at the federal level, whether it's funding for research or working on prevention issues, or maybe it's in your state capital. But the first thing to figure out is kind of where do you want to make that policy change? And one thing I just love about the society's toolkit, which is so well done, is that it really lays out kind of figuring out who that decision maker is as you go forward. And I've seen, especially among women advocates, how hard they work to prepare all of the details, every single statistic, and really doing their own research. And while I certainly think that that is important for you to understand where and how far that policy problem is, I think what is most important is what was mentioned earlier, which is perfecting your story and making it something that you feel comfortable sharing. Former Congresswoman Lois Capps, who was a nurse from California, one time told a group of my advocates that a compelling story will linger in their minds. And Katie, you just underscored that with your comment that you always remember the stories that they left. And whether you are standing up to testify at a local hearing or if you are coming in to meet with your member of Congress, that compelling story is really what's worth giving the most oomph in terms of your preparation. The other thing that I think you can do is, as you are thinking about getting involved, is to look to see if there is an organization, whether it's a state, national, or local organization that works and is involved in your issue already. And maybe you agree with them, and they're doing all of the things that you love after you've had an opportunity to look through their website. Maybe you think that they could do a few things differently, and maybe you think that you could, but you could get started with them. The great thing about so many advocacy organizations, and I'll just speak at the national level, is that they often have programs already set up to help you learn to be a more powerful advocate, to hone your story, to perhaps come to Washington with them, to meet with your members of Congress, to be able to really experience what being a powerful advocate is all about, and to get training from them too. And it really helps a lot of advocates with whom I have worked make this be a little less scary because it can be intimidating, even as you remember that these members work for you. And I think that the toolkit is so good, and of course very consistent with the powerful work that the society does as it walks through all of those pieces. And I think that the last thing that I would say is make sure that you feel comfortable doing what you're doing and that you're bringing the passion to this. Is that being met by the organization? Is that being responded to? And there's a fine line between being passionate and kind of crossing the line into a little bit more of an advocate. But I think that one of the great things is that when you bring your passion and your focus, not only do you help with sharing your story and making it the most compelling, but you give so much to the people who do this day in and day out, and you make and remind all of us why we got into the work that we're doing to begin with. And I think that that is something that helps us go even further. I loved every single one of the Hill Days I've ever done. I've loved because at the end of it, in addition to being physically exhausted, I was emotionally and spiritually buoyed. That I had enough reserve in my tanks again to be able to continue to go forward.
Amazing. Thank you. I love that point. I think you're totally right. And you just really, I think, pinpointed it for me, which is those hill days are really exhausting because it's a lot of moving around. It's a lot of logistics. It's back-to-back conversations, but I always feel energized after that. And so I think that's something too that can be really exciting as you think about an advocacy journey.
And it doesn't even have to be on Capitol Hill, right? It could be at your local state house, or it could even be attending a town council meeting. So there's no reason it has to be in Congress to give you that boost and that shot in the arm.
Excellent point. Erica, there's one other area that maybe we haven't touched upon quite yet when we think about advocacy. We've talked about the patient as an advocate for themselves or for others. We've talked about the role of the federal agencies a little bit. But can you speak a little bit to, as you oversee communications, what's the role of media advocacy in this landscape?
This is really a critical part of an advocacy organizations, but it can be an individual advocate's opportunity to really speak out and have more opportunities to raise their issues. And I think a lot of this could be on social media in a serious way, and in or even in a joking or other way, but with a serious message. But advocates should absolutely use any sort of megaphone that can amplify their message to the so that the people who need to hear it do. We joke that some of the only people left subscribing to newspapers are members of Congress and their staffs. But they read them religiously because of that. And so, whether it is figuring out who writes about a specific topic and reaching out to them, submitting a letter to the editor, so that it is something that is resonant in the community. It might be taking a video and posting it in a place that will with hashtags that will be available. But media advocacy is a really important way to amplify your voice. And they used to, a long time ago, when I first started in this, call it free media, but it is not free. It is earned. But it is a powerful tool for every advocate, particularly women, to be able to express their viewpoints and to get their messages across.
That's an excellent point, and I so appreciate you sharing that. Not only that, yes, it is, while it's technically free in terms of dollars, it does take time and energy. But I will say, every morning when I'd show up to my desk on Capitol Hill, my boss, I don't know when she slept, but she would have clippings at that point in time of any article or op-ed that she had read that she wanted her staff to know about. And so they are reading it, they are monitoring social media. I think my suggestion to advocates in that space would be, if you're going to tweet or post something and tag a member of Congress or an elected official, state level, whatever that looks like, make sure that you are following it up with either a phone call or maybe an email to that person, just to get that extra count there. We used to tally everything, but I think a lot of people, when they're on social media, you think, okay, great, I did it once, I'm done. You do have to keep doing it. And so some of it is, you're the expert in your health and well-being in your life, and that's what you're sharing with them. Be kind about it, but you can be firm and kind at the same time, and have to stay at it. Excellent. Thank you so much, Erica. That was a really important piece of this. I want to take a moment to shift a little bit and shift into the federal agencies and the broader policymaking landscape, because understanding who has influence is just as important as understanding what needs to change and how you might do this. So there's a lot of different ways to approach this. Depending on what your cause is, there's different agencies that might play a role. In health advocacy, for example, much of the action happens within the Department of Health and Human Services, which oversees agencies like the National Institutes of Health, the Food and Drug Administration, the Centers for Disease Control and Prevention, and even the Centers for Medicare and Medicaid Services. So all of those agencies, while they stand alone, are part of an umbrella under the Department of Health and Human Services. So it is good to know who does what. They often work together, but they are independent and separate, and they have their own leadership. Even within those agencies, there's different offices and divisions to be aware of as you're thinking about sort of what it is that you want to get to. But these agencies shape everything from research priorities to product approvals to reimbursement policies. And so knowing what they're working on can help you understand where you want to engage. But it's also important to know that advocacy has shaped these agencies. So, for instance, back in the early 90s, at the Society for Women's Health Research, we were wondering why there was no point person or office that oversaw women's health or research into women's health. And so we were able to work both with the agencies. So some of these offices were stood up on their own within HHS, Department of Health and Human Services, within particular agencies like the FDA, NIH, and CDC. They all have offices of women's health now. But we were able to do that by working directly with them and advocating for it. And then on I don't want to call it the back end, but the other side of it was to codify those offices into law so that, regardless of what was happening in administration priorities, because those do change. And, we're not talking about a lot of money here for these offices, but it is very important and critical to women's health and women's health research. We codified those offices to make sure that they would continue on. So the Office of Research on Women's Health, which is at NIH, that actually was codified. It was created in 1990, or established rather, and then codified and signed into law in 1993 as part of the Revitalization Act. The other offices of women's health were codified into law in 2010 under the Affordable Care Act. So very important here that we understand that you can advocate at both of those levels. It's not just congressional action that might get you where you want to be. Sometimes working with the agencies directly is a way to go. So since we've done all of that, we've had a lot of opportunity, I think, to interact and engage and really make the case for women's health and women's health research. But we also need to look at the congressional side. And there's several key committees that are responsible for developing and overseeing legislation related to health policy or public health and biomedical research. And some of the most influential include, and maybe this is a sign of my bias here, on the funding side, the appropriations committees. The House and Senate both have appropriations committees. Their subcommittees related to labor, health and human services, and education are the subcommittees that we like to look at to advocate for increased or focused funding for women's health research. So that's where we at SWHR and a lot of our partners are advocating every year. That's an annual process, and there's an opportunity to send letters, sign on to letters, sometimes testify in front of Congress on that, bring others with us to do that. And so we want to make sure we're doing that every year. There are other committees that are known as authorizing committees. Those are authorizing programs. And I'm sure we could do a whole webinar talking about the differences between authorizing and appropriating. And likewise, we could, and maybe Erica, we can enlist you in the future on some of this, really thinking about how you want to make sure that what the difference between mandatory and discretionary spending is. That's really super wonky at this moment. You just need to know that there are committees that fund the programs that we advocate for, and there are committees that create or authorize the programs that we care about. Sometimes they will fund, sometimes they don't. You have to use a separate path. But the committees that authorize on the Senate side are the Senate Committee on Health, Education, Labor, and Pensions, and the Senate Finance Committee. I know finance does not sound like it does anything in healthcare, but they oversee Medicare and Medicaid and children's health insurance program. And so they have a really key role in healthcare policy because at the end of the day, healthcare policy has a lot to do with finances and spending. On the House side, there are really two committees of jurisdiction that we look at pretty closely. The House Energy and Commerce Committee, which looks at healthcare policy, Medicaid, Medicare, and public health preparedness, and the Committee on Ways and Means, which also you initially would probably think, oh gosh, that's probably just tax or trade. It includes a subcommittee on health, and they look at Medicare policy specifically. So it's really important on that financing side to make sure that you understand if there's a particular piece of legislation that you're following, what committee is it going through, who sits on that committee. Does a person who sits on that committee happen to be your member of Congress? Even better. So lots of different ways to think about it, but just a basic level of understanding of that, not necessarily the process. It can help influence how your issue gets heard, how you might want to target your advocacy and ensure that your message reaches the people who have the authority to act on it. So it's important to plan ahead. And it can be a lot to manage the logistics surrounding advocacy. But at the end of the day, what advocacy comes down to truly is storytelling. We pair the data, obviously. That's what these organizations like ours and other organizations, nationally recognized local community organizations, they have the data. You have the story because it's your life and you know it best. So the most impactful advocacy goes beyond those data points or the policy briefs, and it's really about real people. It's about your experiences, your challenges, and hopes that can bring an issue to life. They create connection, and that's what moves decision makers to act. So we talked a little bit about how members of Congress are people too, agency officials are people too, and they do, no matter how we approach it, there is a level of our personal experience that influences our lives and understanding of things. And so we want to make sure that we're sharing those experiences. So the toolkit that we have includes tips on how you can strengthen your message, asking questions about like what's your why, behind your advocacy, who might be affected, what change would make a tangible difference to the issue that you care about. And that can really translate an idea into a very compelling call to action. So I want to pull Lauren back up here. She's an accomplished author, motivational speaker, and strategic content and branding expert. And you are really like the person on how do you share your story, the power of storytelling. And I would love for you to share how that's shaped your own advocacy and what your advice is for people who maybe want to start doing this. And that can be, to your point, anything related to as patients, to providers or with providers, as caregivers. How does that storytelling inform their advocacy and interactions?
So, so for me, thank you so much, Kitty. So for me, my storytelling about my own lived experiences started when I was working in women's magazines. And there was an editor in chief. Her name was Joanna Coles. Many of you may know her today. Actually, now she runs the Daily Beast. And she just said, your story about who you are is so powerful and your voice is so powerful, but yet you don't speak about it. But yet everything you do and who you represent could be so powerful to the disability community. And so I said, well, what are you talking about? And she just said, well, you don't even understand what you dispel to the world. And so I really thought about that. And as I thought about that, I wrote my first article, and it was really, it became the most read article for Marie Claire magazine of the year. And what I did was I just thought about the questions that I asked myself and how I think that people perceive me and what I want out of other people, and what I started asking other people and what they thought about me. And I think that when you're physically disabled, the world thinks about you very differently, and how you perceive the world and how they perceive you. And that's kind of how I started storytelling. And what really made me think about and how I have brought so much into storytelling, and my storytelling has become so much of advocacy. And when I'm on the Hill or telling a story, I truly, truly think about what is the end game and what is the advice that I can give to people, right? And so while I'm telling the story, is what is the give back to the person reading the story? So I think it's similar to when you're on the Hill, when an advocate is on the Hill, or when an organization is on the Hill, is what do you want that particular organization to give back to you, or for what you want them to learn from you. And that's kind of what my storytelling has done. And for me, when I'm telling the story, I want that person to almost live that lived experience with me at that moment in time. And so to like kind of like wrap it up in a bow, my message to everybody is, here's what I have done, and here's how you can do it in very simple ways as well. And so everything to me is like, here's the 5 ways, right? So because I come from women's magazines before I got into healthcare, it's like, here's the top 10 ways you could do this. Here's my guide too, kind of like you all have your toolkits, right? I chop things into, here are the 5 ways, here are the questions that I've asked. Here's how now you can take my own lived experiences, put it into your own script, because that's what I want people to do, is take my own experience. Now take that script that I have created for myself think about your own scenario and then put in your own words in it. And I think that that's how we can take your own life experience and then take that and then help somebody else and help somebody else. It's kind of like they say, oh, just take that script, different person, new script, different person, new script, different person. And that's how I believe. And plus, like, the story becomes almost, has like that viral feel. And then when I go into any congressional office, I want that person that's I'm telling that story to feel what I feel as well. Because if I can make them feel what I have gone through, that changes their perception. And that's ultimately what storytelling is, right? I want them to really feel and understand. And that's what will help change policy, I think, right?
Yeah, I
Is that,
think the connection piece, that relationship piece is really critical. And it's something that, you don't know somebody else's perspective until you've heard it and you've had a chance to really consider. And actually, to that point, earlier and offline, we were talking a little bit about this, but I feel like that translates into some of the other work that you're doing. I want you to talk a little bit about how you have gone into medical schools or helped clinicians understand how to interact and engage with patients in a meaningful way.
yeah. And so I think that, I've gone into medical medical schools, I've gone into hospitals to really help doctors and nurses treat us as humans and not just as pincushions. Because a lot of times when you walk in with, for example, for me, I have a rare disease, McCune-Albright syndromes, that they will call a board disease because they have to know it for their medical boards, but then they will never see it again. So when they find out and identify that I have this rare disease, I automatically become like a scientific experiment where they don't look at me as Lauren, they look at me as patient X, right? And so what I do is say, hi, I'm Lauren. I have McCune-Albright syndrome. I need to help you understand about the disease. And I have a million questions for you, but I also need you to understand the disease from my perspective as well. And so I kind of teach them how to be human as well and not just doctors and scientists at that moment in time. And I think that that human interaction is so important between patient and doctor, and not just, oh, I found a new discovery today. And so many times that happens, and or what happens is, I can't help you out, I don't know what to do with you, instead of, I don't really know because I had to know it for my boards, but I've never really seen. So, but let me help you get to the point that I know I can help you. Right. So it's like to humanize it. And I think that's what storytelling does. It humanizes whatever you're going through. Right. Or it helps humanize the story. It helps humanize whatever somebody is going through. And that's what life experience is. Right. And if I can humanize what I'm going through to help somebody else or to help a doctor treat another patient, that's really what my end goal is all the time.
Gosh, it's certainly an amazing life's mission. It has gotten me thinking a little bit that advocates, particularly patient advocates, draw so much on personal experience, that storytelling aspect, that although it can be extremely successful and make a huge impact, it's got to be emotionally taxing, not to mention that physical tax that
Yes.
Erica was talking about in terms of Hill Days. I want to pull Sateria back up here because we've talked a little bit about this idea of self-care and boundaries and how to prevent overwhelm. And as an advocate, I'd love to have you share some of your strategies and sort of how you're thinking about this, just given how deeply personal this is.
Thanks again, Katie. I thought Lauren's comments just, oh, she checked all the boxes. Much of that resonated with me. And thinking on your question, Katie, I reflected back to when I was really in the throes of Before my fourth fibroid surgery, some really horrible menstrual cramping and heavy menstrual bleeding. And I was in a research meeting, and I was understandably trying to contribute to the meeting while in intense pain and very uncomfortable in an all-day meeting. And then after that, once my symptoms were addressed, I found myself in a different place where I felt like I could better support the community, um, because I wasn't suffering. But I think it's important to recognize when you are and utilize all the resources around you, like our community, volunteers. I think sometimes, I know I'm guilty of this, try to be the one woman, superwoman, and that is not sustainable. And so we really need to recognize when we're not feeling well. I think another thing that really boosts my energy, which Lauren referred to, is interfacing with the community. Because when you're an advocate, you don't always see the impact of your work. But when you have the opportunity to interface with community members and hear directly from them on how they've benefited from what you shared, it gives you the best feeling. I think that's the favorite part of what I do, is interfacing with the community and being able to hear and learn and understand and celebrate ways in which their quality of life has been enhanced by way of some information that we've shared, or a story that I've shared, or some of the work that we've done. Um, so I find that that's what keeps me continuously inspired and helps to prevent the burnout. And another thing I think is really critical is advocate to advocate support. That helps with the burnout as well. The opportunity to reach out to you or some of the other advocate founders that we know, and share any maybe even logistical, challenges, or just something we're trying to accomplish. That sensitive ear helps tremendously in helping to move us forward, and to know that there are answers out there. We can do this, and despite the fact that you may be tired in that moment, hope springs eternal.
Yeah, I think that's right. I think often of the network that we've all built, because even if you're not a, particular condition specific advocate, like myself, right? We deal with a lot of different issue areas, but it is a deeply personal issue area. And I think one of the things is being able to reach out to others who can just be supportive, even just as I just need to vent about this, or, oh, are you experiencing this, is so important. And I will point out, as we're like shifting into sort of a little bit of a different tact of this, I received an email from the Fibroid Foundation while we were sitting here that said, "What should your reps know about fibroids?" And so well done. Just like, what do you wish they knew? And it's got quotes from people about what they wished their policymakers knew. And I mean, what a wonderful way of thinking about it. I know you all are gearing up to go to the Hill, but a great way of thinking about how do you prepare for approaching this. And some of that is like, just like you're being armed with, you're practicing your stories, you're making that plan, whether that's using our toolkit or thinking about who you're going to be engaging with. But it's also thinking about how you're going to feel ready, and whether that's rest, which I know we're all probably a little guilty of this, like how do you build in rest, that sort of thing. Find that support system where you need it, so that you can come back and continue. Because the biggest thing about advocacy is it feels like it's never done. Even when you get to that win that you've been getting, trying to get to for years, then you have to think about how you implement something. And then maybe, you don't walk away. You want to be, what is it that we say? If you're not at the table, you're on the menu. You want to make sure that you continue to show up to do that. And that can be taxing, I think, just personally, when you think about your well-being.
Yeah, and I just really quickly would like to add that if someone is kind of feels intimidated by the advocacy process, Lauren referenced her list of 10 things. She gained that experience from a previous life experience. For me, it was business development. So I felt comfortable going to Capitol Hill and trying to assess the needs and the goals of a particular office, when I was having a conversation and how to approach that conversation. And I know that each of us has something that we can reference, something that we feel confident in, that we can bring to advocacy work that is unique and special and has a positive impact.
Yeah, I think that's totally right. Thank you so much for that, because sometimes we do need that reminder. I want to think a little bit about sort of, we talked about storytelling. I mentioned data a little bit and sort of how do you prepare yourself? Again, pairing your storytelling with the facts. In addition to the information on storytelling that's included in our guide, it includes some quick women's health statistics that you can use. So kind of pick and choose your issue area. You use those evidence-based facts to go into your conversations, pair it with your story. We do really find that pairing those things, it creates a clearer picture of the need. And so, this is the individual impact, and how it could make our lives better, our longevity, help us live longer and live better longer. But also, here's the impact on the broader population, because we're not just talking about things that impact one individual person. This is a much broader issue. And we're talking about 51% of the population. So it's really a part of a much larger systemic conversation. But we use our individual stories to share the broader impact. The toolkit also has guidance on how to schedule meetings, which I've mentioned, and how to approach those conversations effectively. So I want to pull Erica back up here, because how to use the time effectively is really important. And even with careful preparation and planning, meetings don't always go as you might hope or plan. They might take a left turn somewhere, not even necessarily in a bad way, but they might go off topic depending on what that person that you're meeting with has just talked with somebody else about. But Erica, can you share with our audience how to navigate those maybe tougher moments and keep the conversation productive when things get difficult?
Absolutely. And sometimes it's that staff or members might ask you a question to which you don't know the answer. And it is 100% okay. And in fact, even better, because it gives you an excuse to follow up. If you say, I don't know the answer to that, but I will get back to you when I've learned that, or I'm happy to follow up with you about that so I get the right bit of information. Not only is that a great way to take a deep breath and to give yourself a little out there, but it provides you that wonderful excuse to get back to the office and follow up to make your ask again. And so I do love I'm happy to get back to you on that, so I can give you the answer to that. But it's also really important, and if you feel at all like you're not sure what kinds of questions you might get, that's another great reason to pair up and be part of a Hill Day with an organization that will send someone with you to answer the hard questions. Um, we one time had a patient asked about what her prognosis was, and she has a terminal diagnosis. And it was, I think it was genuinely a reaction from the member who felt so it was just absolutely caring for this person because of her powerful story. But the question really sunk like a lead balloon. And so one of the great things about going with an organization is that their trained advocates can be ready to jump in and say, Congressman, I'm happy to talk with you about that. Or Senator, here's a little bit more information about that diagnosis, so that the poor patient or you don't have to be the ones trying to articulate that. Um, at the end of the day, your story is always going to be the right answer because there is no one who can argue with your story, because it is your lived experience. But sometimes figuring out a way that you're going to have a buffer, if you get a question that perhaps could have been thought out a little bit more, is a good way to go into Hill Days and meetings in general.
Yeah, I think that's right. And I feel like I've seen everything and I'm still here. And so there's a way we all survive it. But I do think sometimes you do get questions. And I mentioned this, right? Like when I started on Capitol Hill, I was very young. I was just out of college. And you do interact with a lot of young people, or maybe, and again, they are handling multiple issue areas. And so they're in meetings, in 15-minute increments all day long, from agriculture policy to foreign affairs to tax policy to healthcare. And so just thinking about if there's something you don't know, or maybe they might seem a little grumpy for some reason, it's probably not you, but just continue on and offer to serve as a resource and get the information that you think might be helpful for them is really important. Thank you for that. I'm going to pull everybody back up. We have some broad questions here, scenarios that I think our voices or your voices will be very helpful with. And so I want to start with this one. And Lauren, I know you do a lot of this reaching out to policymakers. So curious what you would do in this situation. And the situation is this. I've reached out to my representatives before, but I never really feel like I've been heard, or I didn't even hear back from my person that I had sent an email to. What should they do differently in the future?
Okay. Well, if you know me, I would reach out 50 times. So listen, everybody has something going on. It doesn't mean they may not have seen it. Honestly, in today's world, they probably get 10,000 emails a day. If you've sent an email, even if you've gone to the office, it doesn't mean that that particular legislator has even heard your story. Just because one of their staff members heard you doesn't mean that it's actually gone anywhere. I would email, I would write a personal letter, I would call, I would do everything that you can because you want to be heard. So I would do it as much as you can until you get an answer. And you may not get the answer that you want, but that's okay. So move on, right? Move on. And then just maybe even rework the way that you're telling your story as well. Because what happens today, our news cycles and everything that is happening, it's happening so quickly. So then maybe rework your story and go back again in 3 months too. So I would just keep on approaching and keep on approaching until you get either an answer or the answer that you want.
I think that's right. Erica or Sateria, anything to add there?
Yeah, I would just say to that is that I think it is different for constituents when they reach out, as opposed to paid lobbyists like myself, even with the best possible cause. And so I think it's really important that as Lauren said, constituents feel like they can continue to go back. And I know this sounds weird, but when you send emails to staff, particularly, work on a good subject.
Yeah.
That subject for the email as staff are scrolling through is so important. And if it is kind of mealy or is very generic, like, I want to tell you about, funding for women's health, right? That may not jump through. But something that is more compelling in the subject line, I think, is a really good way to start to get to attention. I'd also
Right.
encourage that you find an email address for a district staff person. If you've emailed into the Washington office to talk to email the staff person there, call or email or both someone in a state or local office. And that can often be the difference, and they are much more likely than to flag that for the health person or the tax person.
Yeah, you might
And
even
I
want
have
to try to
found,
have a meeting there
Yeah.
in the
yeah, I have
district
found a
office.
handwritten letter actually gets through.
Yes, and those
People don't do that today.
that's true. But I would say don't send those to DC. Send those to the district or hand deliver them to the district office. Or if you happen to be in DC, hand deliver them only because the mail gets incinerated basically through screening and it takes forever. So that's the other thing. Like if you're handwriting letters and mailing them by snail mail to DC and you haven't heard back, it's probably because they never arrived or they arrived in a state
Mm,
that can't be read. So that's really important too, to just understand that to your point, Erica, about district staff. 100%. And as someone who worked in a DC office, it was sometimes a little bit like, oh, you don't do the policy, but they in my experience, the district staff like to interact with constituents a lot. And it's much easier for you, especially if you don't live close to DC or you're not here regularly, to go to the district office and have that meeting or to have a little bit more interaction. So definitely something to keep in mind. Satiri, was there anything you wanted to add there?
You all have covered it all, so no.
Okay. Thank you. All right. What about this scenario? And whoever wants to jump in can. There is so much noise, and we're all being told all the time, contact your member of Congress, call the White House. This is happening more and more where groups and organizers there's just so many opportunities to do this, and it feels very overwhelming. And also it feels a little bit like, well, if I raise my voice for this thing, how do I decide when it's important and when it's going to be heard? And it's just very overwhelming. So how does one go about thinking about picking one cause that's best for them? Where is their voice most impactful? How would you decide that?
I think authenticity is really key in
I
navigating
agree.
that. I found that, well, I had a career for 20 plus years in another arena before I became an advocate. And the very genuine energy and serendipitous moments that infuse this passion focused patient story are something that I can't even fully describe. I really feel that when your heart is in something and you just make one effort, that things just kind of open up and fall into place. So, and oddly enough, I view the abundance of issues to resolve as opportunities, for us to really have so much to be able to help people with. So that's how I kind of look at it. I think it's vantage point, and I think it definitely is just where your true, authentic passion lies that will help to propel you forward.
Yeah.
Being an advocate as a volunteer or as your career is not an easy thing to do, right? We do it because we want to make change. We want to make the world better for those around us, especially in the health space. And so I think it's what you can be most passionate about, and to go forward with that. What will keep you coming back every day? There aren't a lot of issues other than health that I could probably lobby on, but I needed to even find them within health that made the most difference for me and my family, whether it's because of our own personal story or because of the cause. So I think that what makes you look forward to getting up and doing every day, and I think that is a good way to figure out what you can do.
Hmm.
Yeah, I would say we're not in it for the glory, but when you get a win, it's really, really exciting. Sorry to cut you off, Lauren.
No, absolutely. I agree with everything that has been said. And one other tip that I have personally used is try to almost match yourself not only with an organization, but with another influencer that matches your own mission and goals, and see if you can create a partnership with them. So you help elevate each other and each other's messages. I have personally done that, whether it be for rare disease and or women's health. And we have uplifted each other and each other's messages. And that has really worked for me. And I think that that can help, especially we live in a world of social media today. And so that can really help get your message out. And you never know who you can reach via social media and who will, want outreach from you as well.
So, Lauren, that actually gets to one of the other questions that we have, which is where can I connect with other advocates or use my voice as part of a group to bring about positive change? So that's one really good tip. I wonder if there's others, if folks want to point. Obviously, we want you all to go to our, advocacy
Yes.
toolkit, but there's lots of other ways to do this as well, and lots of partners out there.
I mean, there's so many groups out there as well, whether it be Facebook groups, whether it be LinkedIn groups, depending on what your advocacy is. So especially for health, um, there's so many different groups. I mean, I found, once I truly determined that I wanted to be an advocate within women's health as well as disability and that intersection, I found a wealth of knowledge and a wealth of groups on Instagram, which was very surprising to me. I already knew about the groups on LinkedIn, but then I started on Instagram and I have found a whole new world there, and women that want to support other women. And so I think that find your niche too. And then there are a million different ways out there as well, but also find, various different advocacy groups. And then there's subcommittees that you can join within those groups as well.
Yeah.
And I think it's really important too to do your homework, like just like you do when you're looking for a provider, when you're looking for an organization, just check to see what their platform is, what their mission is, how you can interact with them, what their reach is, and see how it aligns with what you would like to accomplish. And then that will get you pretty far.
Yeah. I think that's right. How are we all staying positive in the noise, in the chaos, right? I was somewhere earlier this week, and that old saying, "In the chaos comes great opportunity," but it also is, again, it can be exhausting. So how are we staying positive through this?
I try to find
Uh,
ways to be with my fellow advocates, to sustain, one person maybe having a hard day and the other person lifts them up, to Lauren's point, just finding somebody to bounce things off of in that way. Group texts, they are my salvation, with my fellow advocates. Sometimes it's darker humor on the rougher days, but I think that as we can continue to lift each other up, we do that. And I will also say, Insta dog videos are my go-to. They always make me feel better.
Music is mine. Music makes me feel better.
For
And I think we're 51% of the population. Like, let's
Like,
just throw that
yeah.
out there. We gather together.
We gather together.
Yeah.
And for us, or for me, I think I feel so fortunate to work with a group of wonderful people that we're friends and coworkers. And so when the tough days are are taking place, it's nice to be in a positive environment with people who can help uplift you.
Yeah. I think we find our tribe.
Mhm.
All right. Well, thank you for that. I have two more questions for you. One is there one lesson that you would want to relay or share to anyone who's watching this video that you've learned from all of your years in advocacy? Just one.
Don't be afraid to use your voice.
That's it. That's it.
And as important as your issue is, because it is important, recognize that there are, it may, you don't have to push your issue on the staff or the members to have it resonate with them. Um, I think that sometimes we might say our disease is the worst. But you might be talking to someone whose loved one or parent or they themselves are going through a horrible journey of a different kind. And I think it is really important that we not get lost in our own advocacy, um, and not take the moment to stop and recognize that this is where we are, this kind of experience or hell that we're in right now, may not be exactly understood or shared by the person with whom we are speaking. But they may be in their own kind of journey and their own kind of position. And I think it's very important that we acknowledge that this is where we are, but it may not be where everyone else is. And you can still raise awareness. You can still bring action to have your particular issue acted upon without pushing down other issues that may end up getting you on a do not reply list for an office if you have stepped too far.
Yeah, I think that staying positive and engaging in a fruitful and productive conversation is really important. So to almost to that point, sort of our last question for you all before we wrap up is that this is advocacy is not A, for the faint of heart, but B, it takes a long time. And I think about this within the context of the Society for Women's Health Research. We were founded in 1990. If you look at our historical documents stemming from before that, even 1989, a lot of the way in which we frame the need for women's health research or closing the women's health gap is actually the same as it was 36 years ago, which is not a bad thing. It's just that this takes time, right? It takes years to get something from idea to building your champions to getting something signed into law if that's the direction that you go, or getting an administration or an agency to be able to put out a rule or make a policy change. And so this is a marathon. It is absolutely not a sprint. And so can each of you speak to a success that you've had? And what did that change look like?
Sometimes it happens organically. I was in Montreal speaking to at a physicians conference, and I said that women don't want to hear just because they're 40-ish that they can get a hysterectomy to resolve their issues. And I thought I was just kind of speaking something that was logical, but it had a ripple effect through the conference that I didn't know until it was brought up to me that because of the physician's training to provide that feedback to patients, that it was not front of mind for them to think that a woman didn't think of her uterus as disposable. And so those are some of the moments. And years later, I hear from people who were at that conference saying, I remember when you said, and I'm just kind of taken aback because I just thought it was just like a normal day, just, speaking what made sense. But it really resonated deeply with some of the physicians there and some of the recordings since. And so when I think definitely of that as a win, even though I didn't intend for it to have that impact. But I think you'd be surprised from your vantage point how much you have to contribute to advancing a cause or um, relating to another person or presenting a different vantage point that you may inherently think is just second nature, but it could be transformative to someone else for their work or themselves personally.
Amazing.
I'm a patient. I'm part of a natural history study at the NIH, and I didn't know about it until I was in my 30s. And when I first learned about it and I went to the NIH, they invited me to a day where you can meet all of the patients. And they said, we've been doing this for years. And it was just basically the doctors speaking to the patients. And it was like the doctors were speaking to themselves. And it was scary. And I said to them, they looked at my face and I said, this is horrifying. And I said, you're talking to us like you're talking to another doctor. You're speaking at us. You're not speaking to us. And I said, can't we, why can't the patient speak to you and ask us and ask you the scary questions? And they said, well, we never thought about that. And so now we have a day where we have a patient day. And so we've changed the way at the NIH on how the doctors see the patients and the patients see the doctors. It's
What a
really
win.
important.
Amazing.
I have been fortunate, or maybe I've just been around so long, is that the I've had a few legislative victories, bills becoming law, and other things. But I think that perhaps the most rewarding win is every year when I've done a Hill Day. You could tell the individuals who are most anxious about coming to Washington, about sharing their story and being able to find their voice and to understand that their story is worth being heard and told. And then when I sit in their meeting with them and have them, especially by the end of the day, and they've said it a couple times, be confident and realize that they have a voice that is worth sharing, a voice and that is worth with raising, and that story that needs to be heard and told. And so I think ultimately at the end of the day, training individuals and giving them the confidence so that they feel inspired to go in and raise their voices is the best part of doing what we do and the biggest kind of win.
Oh my gosh. I love it. Everyone had such wonderful wins. And that is a truly positive note that I think we can all take away with us. So hopefully for our audience today has been a period of time where we've all been reminded of two things that I think are really true. Number one, meaningful progress takes a long time. It does not happen overnight. We have to keep showing up. And number two, every single breakthrough or change really truly starts with an individual or a group of people who are here to take action. And so hopefully we've been able to inspire. I know I feel really inspired and hopeful, but hopefully our audience has felt inspired to take some action here. So thank you to our amazing, wonderful friends and speakers who so willingly jumped in and said yes when we talked about doing this. I so appreciate it. I know the society does as well. And for sharing your passion and your work and your lessons with everyone. And I want to thank our audience for joining us and sharing your passion and your energy and hopefully a renewed commitment to advocating for women's health. So whether you're just beginning to do this or you're looking to strengthen your work, we hope that we've been able to show you that your voice does matter and that you can make change. We've walked through sort of how do you plan, how might you approach it, understanding the landscape a little bit, pairing data with your lived experience, and that really creates powerful and persuasive messages. And we know that advocacy can sometimes feel overwhelming, but tools like our guide and resources like our speakers and their organizations and the work that they're doing, it really, all of these together are designed to make it more accessible, more strategic and thoughtful, and at the end of the day, more impactful. So everything that we discussed today and even more, everything that you want to know is included in our online guide. The QR code is here. It is free. It's accessible to anyone who wants to use it. We really want you to please share it. And again, that's called From Awareness to Action, a guide to women's health advocacy. SWHR.org is where you can find it. We hope that you'll explore it, share it with your friends and colleagues, and use it as a resource. But a huge heartfelt thank you to our speakers and to our audience for joining us today.